citing other commitments. They did, however, send a brief message, which I will read out later in the session. Before I begin, 3 preliminary points to make, which I think are quite important. First thing to say is that this is a crisis that has affected countries all over the world. Here in the UK, our record on COVID-19 is pretty shocking. The Financial Times reports that we've had more deaths as a proportion of the population than any other country in the world. I think it's wise that we all remember that the UK is in no position to judge any other country, be it Tanzania or any other country indeed in the world in this situation. And it is certainly not our intention to judge Tanzania in this discussion today. Second point, every country has to find its own way through this situation, one that is suited to the local social and economic context. We should avoid recommendations that suggest copy and paste. In particular, lockdowns may not be the best response in every case. Respected academics, including from the Institute for Development Studies at the University of Sussex, have argued this. Their point is that where populations are young on average and economies are largely informal, both of which apply very clearly to Tanzania, lockdowns could have more negative effects than positive. Third, it should go without saying, and yet it does need saying, unfortunately, that we all sincerely hope and pray, each in our own different ways, that Tanzania is spared the worst of the pandemic. In trying to understand the situation, and indeed in critiquing the national response, nothing anyone says here should be interpreted as hoping for anything other than the smallest possible impact of COVID-19 on the lives and livelihoods of Tanzanian citizens. A note on the procedure for tonight. First up, I will use the prerogative of the chair to set the context a little. After that, I will analyze and invite each of them to speak for 10 to 15 minutes each. I may ask questions of the panelists, particularly if important matters have not yet been raised. And then finally, I will invite questions and comments from the floor. For this, we'll use both the chat facility of Zoom, which you can see if you're on a computer screen, you can see at the bottom of the screen. If you're on a phone or a tablet, it may be somewhere else, but I'm sure you can find the chat facility when we need it. And there's also the raise hand facility on the participant list, I think, which we will use if people want to actually speak during the discussion. If you want to ask your question without speaking publicly, then by all means use the chat for that purpose. And with that out of the way, let's get started on the main agenda. So briefly, what do we know about COVID-19 in Tanzania? Well, the first recognized case was reported on March the 16th in Arusha. This and other early cases were among those who had recently traveled from abroad. The first death was reported on March the 31st, and local transmission was reported by the Minister of Health, Umi Mwalimu, in early April. Reported cases showed a rapid rise in numbers during April, from 32 cases on the 12th to 284 just 10 days later, and 480 by the end of the month. What early steps did the country take in response? Well, as soon as the first cases were reported, the government closed all schools and universities and suspended sporting events. A 14-day quarantine on international arrivals was introduced in March, and all international commercial passenger flights were suspended in early April. Some restrictions on internal travel were also introduced, and there was extensive public health messaging to promote hand washing and social distancing, and a little bit later also masks. One thing that's very particular about the Tanzanian national response is how the President Magufuli, has imposed his personal style on the national response. This includes a big focus on prayer and God's intervention to protect individuals and the country. The President has encouraged people to attend religious services specifically for this purpose. A clear point there is that whatever lockdown measures there have been introduced, and there haven't been many in Tanzania, religious services have certainly not been part of that. People have been encouraged to continue attending religious services. The president has also tried to reduce public fear. He said that fear is a very bad thing. There might well already be people in this situation who have been killed by fear. Let us put an end to fear. Let us defeat fear. The president also aims to keep the economy moving. He argued that a lockdown would have devastating effects on individuals' livelihoods and on the national economy. He strongly refuted calls to introduce any form of lockdown in Tanzania. Finally, control the information. I'll say more about this shortly, and I'm sure we'll hear something from the panelists on that point as well. Testing. We've seen how tests were showing a growing outbreak in April. However, there's been no further reporting of tests from mainland Tanzania since April the 29th. That's a whole month ago, and early May on Zanzibar. The official line is that there have been 510 positive cases, though that number is at least 3 weeks old. We should also compare the 642 reported tests carried out in Tanzania, 652 reported tests compared to over 60,000 in Kenya, 60,000 in Rwanda, and 80,000 in Uganda. At the start of May, the president took issue with the reliability of testing kits. He famously stated publicly that he had sent samples from goats, pawpaws, quails, and other sources to the National Laboratory without revealing that these were samples from such sources, and that some of these samples came back with positive results. So the president was essentially saying that the National Laboratory or the testing kits at the National Laboratory were not performing as they should have done. An investigation at the National Laboratory was ordered in response. This reported back a few days ago, reporting that there were indeed problems at the National Laboratory, and a new laboratory has been established with the goal of restarting a testing process in Tanzania. So we don't have a lot of data on the situation in Tanzania as it is. We don't know how many people have been tested, or indeed on how many positive test results there have been, or indeed on how many deaths there have been. That data does not exist currently in Tanzania, at least not in public. What we do have, one thing we do have is the models. The epidemiologists have looked at the situation in Tanzania in a general sense, not in looking at specific data for the early days of the outbreak, but rather looking at the demographic breakdown of Tanzania and various other factors, and projecting how they foresee the outbreak may play out in Tanzania. Imperial College in London has produced an estimate of 6,000 deaths per million population across Africa. If that was translated at that proportion into Tanzania, that would be equivalent to 360,000 deaths in Tanzania. That we should emphasize is if outbreaks are uncontrolled. The World Health Organization model is much more positive, though still disconcerting. It projects around 10,000 deaths in Tanzania. 10,000 and 360,000 are obviously very different estimates, however. The London School of Hygiene and Tropical Medicine projects a figure roughly halfway between the two, somewhere between 150,000 and 200,000 if the outbreak is uncontrolled. All these epidemiological models, however, emphasize that there's nothing inevitable about these figures. They all predict that there would be much lower numbers with mitigation measures. They also all predict, interestingly, although less dramatically, they also all predict that the peak will fall sometime around July to August. So not just yet, but sometime in a month or two, or 2 or 3 months even from now, would be the likely peak. So the current situation is that we don't have reliable data to update these models based on developments on the ground. In particular, we have no new data on positive cases or deaths in the last month for the mainland, or for the last 3 weeks on Zanzibar. Nevertheless, despite the lack of testing data, there are some suggestions that Tanzania may be past a peak already. The government in particular is reporting success. The Prime Minister, Kassim Majaliwa, spoke at Eid al-Fitr prayers on Sunday. He said that the number of patients has continued to drop across the country. As of Saturday, he said, there were only 3 patients in Dar es Salaam, 16 in Kibaha and 3 in Dodoma. The Dar es Salaam-based centres Mlonganzila, Amana and Aga Khan, he said, have 1 patient each, while Kairuki, Rabinisia, Regency and Temeke hospitals have none. The the Medical Association of Tanzania, essentially the doctors' union, has been reported this week by the Daily News as backing up those numbers from their own reports, though also expressing concerns that some patients are not reporting to health facilities. Last week, the president announced some reopening measures on the basis that, by their argument, the peak in Tanzania has passed. They announced some reopening measures, including colleges and universities and Form 6, the highest level of secondary school, will reopen next week on June 1st, though there will be no reopening of other secondary or primary schools just yet. Sporting and drama events are also set to restart next week. Charter flights into the country have already been re-allowed with no quarantine measures except where passengers show symptoms. And finally, preventive measures such as promotion of hand washing, social distancing where possible, and mask wearing are to remain in place. And that's a big part of what the government sees as the way forward. And with that brief introduction, let me introduce our panel. We have 3 speakers lined up today. First to speak will be Fatma Karume. Fatma is a lawyer, an activist, and former president of the Tanganyika Law Society. She'll be followed by Roland Ebole, a researcher with Amnesty International focused on East Africa, including Tanzania. And finally, we will have Zitto Kabwe, assuming he's able to join us. He's an MP with the opposition party ACT Wazalendo, of which he is the party leader. Before I invite Fatma, as I mentioned earlier, we invited the Tanzanian High Commission in London also to speak. They declined, citing other commitments, but sent a message, and I quote, the government of the United Republic of Tanzania has set up a coordinating team under the chair of the Honourable Prime Minister Kassim Majaliwa. His office is tasked with the responsibility of giving all information and data on the situation on a regular basis. And with that, let me hand straight over to our first panelist, Fatma Karume. Fatma, karibu sana.
Asante sana, Ben. Good evening, everybody. Nice to meet you all. Just to take over from Ben, I think Ben has given an absolutely fantastic background to what has happened in Tanzania in the last 2 months with respect to our COVID response and with respect to the government's approach to COVID and the deaths and how they wish to deal with it, particularly, I think, the presidential approach to it, because I think as friends of Tanzania, you should be aware, or you are aware, that our system is such that it is a highly emperor system. So the president is basically, becomes an emperor. He asks us for a vote, for our votes, and then once he's given the seat, our constitution makes him an emperor, and what he says goes. So I think that's very clear, but I would like to clarify from a legal perspective. The problem that I see here is the government has decided, there is a debate amongst in general public and the world, whether one looks at public health and puts emphasis on the public health as opposed to economic welfare, or one puts economic welfare before public health, or can these two survive together? In Tanzania, it's clear that we've decided that economic welfare comes above public health. So our emphasis has been on economic welfare. The president has made it very clear that Dar es Salaam will keep running. And the reason for that, he has said, is Dar es Salaam contributes 80% of tax collections for the whole of the United Republic of Tanzania. And Dar es Salaam is the second most affected city. Well, I think it's now probably the first in Tanzania with COVID-19, but he insists that it needs to keep running economically, because if it doesn't run, we will have tax problems, tax collection problems, and the government will not be able to pay salaries. Now, what he has done is, in my view, quite clever. He has pitted public health against economic welfare, and he has individualized economic welfare so that he talks about people starving if they don't go out to work. So immediately the individual stops thinking about public health as a matter of importance and starts thinking about his own economic welfare. He then has pitted public health against religion and God. So if you believe in God, he will help you through this. So it now becomes not an objective issue, it's subjective. If you have enough belief in God, you should be able to pass through this and to get away with this. And I think the majority of the people have bought into this, particularly given the poverty in Tanzania and the fact that Tanzanians don't really believe that government is there to provide them with social welfare. Their view is they have to go out and earn a living. And a lot of the people in a city like Dar es Salaam live from who can't afford social distancing and any form of lockdown. And when I say lockdown, I mean staying, because that would mean they wouldn't be able to put food on the table. My view, of course, is one has to be moderate about this. It's not a choice between public health and economic welfare. You can be moderate and come to a happy conclusion where the government is take cognizance of the importance of public health, and at the same time is aware of economic welfare for the people. Unfortunately, I feel, in my view, that too much emphasis has been placed on economic welfare as opposed to public health. Now, we have had, with respect to, and I'm just talking here about somebody who has lived through the pandemic in Dar es Salaam, and this is my personal view, and I don't have any evidence of this. It is just from personal experience and what I have experienced in the last few weeks from March 16th. So on March 16th, we heard of the first person who was diagnosed with COVID-19. March 31st, the first victim passed away, and he was a personal friend of mine, and he was in his 40s. What is important, and he had young children, what is important to note is Thereafter, we had lots of cases of known members of the public with this COVID-19, but who are not going to the government to be tested, particularly amongst the wealthier community. And this was happening, the infection rate went up very, very fast amongst the wealthy communities within Dar es Salaam. And I take this, I see this as a, with all things imported in Tanzania, they will hit the wealthier communities first. And COVID is an imported illness. And so the working classes in Tanzania it didn't hit them at all. And therefore, I do believe that the projection that the peak will come in July and August is unfortunately right. Because what happened is that we had a peak amongst the wealthy community in late April. There was one Monday I woke up and I knew 5 people who'd passed away from this. And it was a terrible day. But thereafter, the deaths kept rising. And as with all wealthy people, they managed to lock themselves in behind their big gates, in their big houses, and it slowed down. And when the Prime Minister talks about the hospitals, Aga Khan, it's a private hospital, you cannot get a bed there or be looked after if you do not have in your pocket, you can't deposit $5,000 or you have a very good health insurance. With respect to the other hospitals, Kairuki is a private hospital. The only public hospital the Prime Minister has mentioned is Amana and Mlogonzila. So you can see that the private hospitals were inundated with cases of COVID-19, and deaths were happening amongst this particular social class. What is worrying, and for me, this is very worrying, because the people who can afford it locked down themselves, despite the fact that there wasn't a call for lockdown by the government. They locked themselves down in their big houses, closed the gates, worked from home, and if they were very ill, they went to private hospitals and were looked after. My concern at the moment is that we are now hearing from our neighbors. Tanzania has stopped testing, but Kenya and Uganda and Rwanda are still testing, and so is Zambia. And as you all know, as Tanzania, Dar es Salaam is a gateway to Uganda, to Zambia, to Malawi, and to Rwanda, and to Eastern Congo. And what we're hearing from Kenya, Uganda, Rwanda, and Zambia are that our truck drivers are infected. And if we go, that's very worrying, because for me, it shows that the disease is moving down the pyramid. And we have now decided to open up without any scientific basis. The government has just looked at what has happened in Dar es Salaam, in the private hospitals in Dar es Salaam, amongst a very, very limited social class, and have decided that the disease has reached its peak. But there is external evidence that's coming from our neighbors that the disease is still there, and it's working its way down, and it's working its way across the country, because truck drivers who drive from Dar es Salaam to Zambia will spend 2 days on the road, will stop in Morogoro, another hotbed of the disease, will stop in Morogoro, spend a night there, and then move on. And what we do know about the AIDS epidemic, it was truck drivers who spread it around the country. So this for me is a huge, huge concern. One of the arguments that's coming out, and I've seen this because I'm quite active on Twitter, and I do provoke quite a lot, so I get information back. One of the arguments is that there was an argument at the beginning of herd immunity. And the reasons for this is there's a belief that we have a young population and we are not, the demographics are different from European demographics, and we ought not to suffer as much. Okay, well, that's fair enough. But there is one thing that has not been taken into consideration with this approach of herd immunity. We may have a young demographic, but we also need doctors, we need qualified lawyers, we need qualified teachers, we need qualified technicians, civil servants who are qualified and with experience. So if you allow this disease to spread, you're not only this demographic of experts are going to get it too. And when do you become an expert? So in Tanzania, the average child starts school between the age of 7 and 9. And by the time they finish school and they go to university, let's take an example of a doctor. So it's 7 years of university. They start university at the age of 23 and they finish at the age of 30. And then they specialize for another 4 years. And then they take another 10 years to really become experts at what they do. You end up, by the time you have an expert, they're in their 40s. And there are very few of them. And they're vulnerable. These are not 18-year-olds. They're vulnerable. So what will happen if we allow this disease, if we go for the herd immunity? We may not, in the end, have mass deaths and bodies in the streets. But what we will have is a brain drain caused by the epidemic. And that for me is very scary, because how do we then make up that difference in a short period of time? You cannot make up, you can't get a specialized gynecologist in a period of 3 years. It's not possible. And I worry about that very much so. So in conclusion, I think putting economic welfare before public health is very short-term thinking. And if this plays out the way it has played out in other countries, we're going to come a little unstuck. Thank you.
Thank you very much, Fatma. That was wonderful. Thank you very much. It's great to have you with us and able to present on this topic today. I'm going to go straight on to our next speaker. This is Roland Ebole, who's a researcher with Amnesty International, focused on East Africa, including Tanzania. Roland, karibu sana.
Yes. Asante sana, Ben. Hamjamboni wote. How are you all? I'll speak more from a human rights perspective, and speaking mostly towards issues around freedom of expression and false news or misinformation in the context of COVID-19 pandemic in Tanzania. As we all know that we are all aware, and Ben has mentioned it very eloquently that the last official information that we got from government with regards to numbers on COVID-19 in Tanzania, both in terms of confirmed cases and the number of deaths was in April, and that was 29th April. Actually, Ben said it's at least 3 weeks, but if you count down to when we are today, it is actually 4 weeks. It is a month since we last received any form of information. But again, while the state is not giving any official information on COVID-19, the state has put various limitations on the right of freedom of expression with regards to COVID-19. And we may all know that since the first case was reported in the region, up to now, there are at least 6 media outlets that have found themselves the receiving end with the Tanzanian authorities because of their reporting. 3 of them, which are TV stations, were forced to pay a fine for reporting on COVID-19. A newspaper, I think it was Mwananchi online, the online segment of Mwananchi newspaper, which is owned by Nation media, that's as in a Kenyan company, was suspended for 6 months for reporting about President Magufuli being seen in his village Chato mingling with villagers. I think it was after church worship service where he'd gone to buy fish. It was in a fish market, and the newspaper was suspended because of misinformation, that whatever image that they used was an old image, and all that. We also have individual journalists that have been either intimidated, and one of them last month was also suspended for 6 months for his post on Facebook. So yes, there is a lot of that going on. And so the problem that we see in such a situation whereby the government is not providing official or information to members of the public is that you have a situation where there is no media providing any information. Government has stopped providing information. A lot of rumor going on about numbers of infections and number of deaths and all that. But even while all this is going on, individuals cannot speak about COVID-19. On 22nd of April, President Magufuli gave a warning, a stern warning to bloggers, and gave instructions to the security agencies to arrest anybody that would be passing misinformation or fear. And one thing that we have to know is that these prohibitions are blanket, and they are based on vague and ambiguous concepts. False news. What is false news? Or spreading misinformation while there is no official information. And if these are left to go on, we have a situation where there is a lot of fear. If you ask a Tanzanian to speak or to give you any information about COVID-19, most of them will just get afraid and not talk to you. I would want to imagine that if it was any other country in the region, the organizers of this forum would have easily gotten a doctor, a medical doctor, to actually appear in and speak in this discussion. But you cannot get that in Tanzania. You cannot get a government official to just, come and speak and give information on this. Of course, we are told that the office of the Prime Minister, which is mandated on giving, this information, is giving periodic information. But where is this information? So there is a lot that we are seeing where, measures that are being taken by authorities in Tanzania are already having a chilling effect on the population and the media. They have led to self-censorship out of fear of reprisal. And we continue documenting or looking at, instances where these limitations appear not, to be imposed for the legitimate purposes of protecting public health, but they are there to actually suppress relevant information or to target critical voices. Again, one of the other things that we are seeing around this time in Tanzania, and this is very much related to that, is an issue whereby, and Fatma has alluded a lot to that, issues around cooperation, regional and international cooperation and solidarity. And you've been given details of how Kenya, Uganda, Rwanda, Zambia are, doing tests and really controlling, trying to contain the spread of COVID-19. Of course, we cannot judge any state's public health measures right now. Of course, we cannot say that Uganda is right for imposing the lockdown that it has done, or Kenya for the curfews, or Rwanda for the lockdown. But we're already seeing a lot of push and pull between Tanzania and these countries. First of all, just a few days ago, we've had issues between the authorities in Kenya and authorities in Tanzania with regards to certain borders, especially the Namanga border, whereby there have been reported cases where Tanzanian truck drivers getting into Kenya have been reported to or have been confirmed to have COVID-19. These cases led to the President Kenyatta, announcing a measure whereby he said that borders between Tanzania and Kenya would be closed unless it is for cargo or for such kind of transport. Then Tanzania retaliated and said that, you know what, you are reporting that many Tanzanians have got, or many Tanzanian truck drivers entering Kenya have got COVID-19 or are confirmed to have COVID-19. Yet, the cases that we are receiving from Kenya to Tanzania are actually the ones that are more. In fact, the numbers, the cases that you've tested, and in one reference, there was a case whereby Kenya claimed that 19 truck drivers from Tanzania were confirmed to have COVID-19 and were not allowed or sent back to Tanzania. Tanzania came back with counterclaims saying that these 19 people were later on tested and not found to have COVID-19. So there became a lot of push and pull until there had to be intervention from the presidents themselves and the trade ministers from the two countries. And the case is not just for Kenya. The border between Rwanda and Tanzania, there was a similar case whereby at some point, because of the measures that Rwanda had made in terms of trying to prevent infections through truck drivers, had made certain requirements for testing. And so at some point, truck drivers from Tanzania really took up and decided, we are not going to allow drivers from Rwanda to access Tanzania. So what this does is that it really limits the kind of solidarity or regional cooperation that would in the end really be useful in terms of containing COVID-19. Recently, there was a meeting of heads of state, the East Africa Community heads of state, and the meeting actually made a lot of resolve in terms of containing COVID-19. But in this meeting, the Tanzania president was actually missing. So we are seeing already in terms of even moving into the future post-COVID-19, or where there has to be a regional cooperation because we share borders. Any measure that a state does outside Tanzania really has to be supported by, the neighboring countries really have to work together in terms of their public health measures or measures they are putting in place to contain COVID-19. But if we have a situation whereby one country perhaps lags behind and, maybe because of, certain elements of threats, maybe, pushes other countries to really toe the line and continue, trade or other kind of, interactions, then we're seeing a lot of problems coming in. To maybe come closer to an end is that, in a situations like right now where we have a pandemic, it is really up to government to speak confidence to its population. And by speaking confidence, I go back to the issue of getting Tanzanians to really understand the dangers or the real situation that they are facing so that they can take charge of their health. Without this, we can do very little in terms of preventing any other sources of information or any other rumors coming out. In the region, I would want to warn you or tell you that we are seeing various forms of human rights abuses, human rights violations. For instance, in Kenya, at the start of implementation of the curfew measures, there was a lot of police brutality whereby, instead of police facilitating, night curfews, people to get home before the curfew hours, there was a lot of, police using force to beat those people who are caught outside the curfew hours. Of course, in Uganda, there are a lot of cases where military and police have, used force to really, go after people breaking lockdown measures. We have had cases of women dying, especially pregnant women losing, their babies, because they could not access hospital. So there are different challenges happening across the board. The Tanzanian one is unique on issues around freedom of expression. And as I said, as I conclude, one thing that, and in my thinking, is very important right now for Tanzania to do is really to allow participation of media, to allow participation of civil society, to allow participation of, organizations that want to really get involved and help contain COVID-19. Without that, we will continue groping under rumors, continue groping under information that is not there, and continue arresting people, innocent people, just because of their expression. Thank you very much, Ben.
Thank you very much, Roland. That was very interesting perspective. Great to hear from you. I'm going to move straight on to introduce our third panelist today, which is Zitto Kabwe MP. I don't think Zitto needs much introduction. He may want to introduce himself as well.
Thank you very much, Ben.
Zitto, can I just interrupt you briefly?
Yeah.
Please, can you go and take that shirt off and put a different one on?
No. And I did it purposely because we are the champions, right?
Not yet. No, he was
yeah, thank you so much. A lot has been briefed by Fatma and Roland. I have very few remarks to make regarding to this. One, it is clearly agreed to a lot of stakeholders that the government of Tanzania approach or response to COVID-19 was underwhelming, uncoordinated, and it totally lacked transparency. And for that matter, the different organizations, whether political or non-political, took efforts to work with people in order to prevent the spread of the virus to the community and to prevent people from contacting, which a lot of work was done, but not very successfully, because the measures taken by the government were very flexible. For example, schools were closed, but churches and mosques continued to have a lot of people in them. So in real sense, you are not doing anything with that. So, and also some of the organizations, including political parties like mine, continue to hold the government to account up to moment, either by talking to the people directly through community radio, through social media, or issuing statements or writing letters to the other heads of states in the region like East Africa or SADC and the like, because of the lack of the regional coordination that we experienced. But what we are getting from frontline workers is contrary to what's the official government data are giving. For example, we are told, and a lot of people are saying so, which has some truth in it, that hospitals are not overwhelmed. But we know, and a number of doctors have told me confidently, and very credible sources, that hospitals were decongested. And they were decongested after the first travel alert or health alert given by the US Embassy in Dar es Salaam. So it was like they wanted to prove the US Embassy wrong, rather than dealing with the health of the people. Secondly, isolation centers were closed. And thirdly, people with mild and moderate symptoms were told to go home. So if they go to hospital, they are just told, go buy paracetamol, just stay at home, and the like. So there is no testing, although some testing have been done. I will explain that in the near future. But also a lot of people are told, just go home. So you cannot use a measure of number of patients in hospital as a yardstick, as a measure to say COVID-19 has decreased or not, because people are told to go home and tests are not being done. Yesterday, I had a conversation with one of the government official working in the Ministry of Health at the laboratory, the National Laboratory Department, and he told me that they are now currently they are testing truck drivers alone, and they are doing this because the government wants to continue trading with Rwanda and Kenya and Uganda. And there is no problem with Burundi, because the approach Burundi has taken is the same as the approach that Tanzania has taken. But the problem has been Zambia, has been Kenya, has been Uganda. Just yesterday, Uganda tested truck drivers and 14 were found positive. So you can see They have traveled all the way from Dar es Salaam with a number of stops all the way to Mtukula border, and they tested positive. How many people have been infected on the way? But one thing that doctors have told me is that they do their responsibility. They take samples and they send samples to the national laboratory, to the testing laboratory. They do not receive the feedback from there. And they estimate that from their experience as frontline health care workers, there should be between 16,000 and 20,000 cases in Tanzania, based on the people that go to hospital and being told, you have just a mild symptom or whatever, just go home. They take samples, but samples do not come back. So this is just an estimate they give based on the people they come across with. And we are doing some work. I know it is a dangerous work, but it is our responsibility to do so as a political party. And we are working with other people as well. And up to yesterday evening, we have in a region of 400 to 500 data on the number of people who have died. And we are collecting this information and we will verify them. We'll with their names, we'll present to the government authorities for verification, because there are a lot of night barriers in the month of April. And also there are a lot of deaths happening in the streets without any record. And that's why we think the way the government is handling this issue is extremely dangerous. So there is no testing going on. The last update on the cases and deaths and recoveries was on 29th of April. And the information we get that the last tests were conducted, with the exception of the truck drivers. The last tests were conducted on the 5th of May. Since then, there have been none. No isolation. Isolation centers are no longer operating. There was a plan to have a big isolation center because of the worry of the eruption of the community spread, community infection. But that area, in the area called Sabasaba, for those who know Dar es Salaam, but they are not doing it. They are closing it on the orders of the president. And there is no tracing. As I said, people go to hospitals, they are being told go back home, no tracing. Even if they had some moderate symptoms. So in total, it is very difficult to state in a very accurate way the state of COVID-19 in Tanzania because of the lack of data, lack of transparency. The media in Tanzania is not reporting this. There is a clear guideline given by the government using the Media Services Act that was passed in 2016 to tell the media houses what to report and what not to report. And for example, you read more about COVID-19 in Tanzania through the foreign media, not through the local media. Local media cannot even publish some of our press statements that we issue because of the suppression and the media oppression that is being done in the country. So now, what's the way forward for us? We are banking on the role of WHO. We know WHO has limitations, but we are pressurizing the government to allow WHO to conduct verification tests in the country in order to be able to report accurately on the COVID-19 pandemic in Tanzania. I think I'll stop there for the moment. If there will be any questions, I'll be very happy to respond to the questions. Thank you very much.
Thank you very much, Zitto. It's great that you're able to join us today. Before I open the floor to questions from all participants, could I just take the prerogative of the chair and ask our three panelists to respond to a couple of particular questions that I had in response to their presentations. Firstly, particularly for Fatma, but others may want to respond to this as well. On the economic question, on the economic consequences of a lockdown, given that the debate around lockdowns is not clear-cut, the economic consequences of a lockdown, it is genuinely possible that they could be much worse than the health consequences of not locking down. Is that not something that the government is right to be taking seriously? That it's important for the government to also bear in mind the economic consequences in the medium and longer term of lockdown and what that might mean for lives and livelihoods in Tanzania. My second question, with Roland in mind, but others again may want to respond to this, is the President has spoken a lot about fear as a significant factor in this situation. He's talked about also how a lot of actors on social media, bloggers, people on Twitter and so on, and indeed people in the international media are acting deliberately to create fear and undermine Tanzania's response in this situation in order to weaken the country going forward. And I'd like to hear some thoughts on that suggestion. And finally, Zitto, you mentioned that based on estimates from doctors, there could be as many as 16 or 20,000 cases already in Tanzania. Those are pretty high numbers. Those are pretty shockingly high numbers in some ways. So I'm wondering, if that's the case, surely we would be seeing far more people being ill and people dying, which is, those are difficult things to cover up. Those are difficult things for the government to hide and make it impossible for the media and indeed the international media to see and report on. Those figures sound very high to me, and I'd like you to kind of justify those numbers a little bit, if possible. If it's okay, I'll go first to Fatma Karume, if you have any response to any of those issues.
Well, thank you. Let me just get back on video. Yeah. So I'm not one who likes any types of extremes. I'm completely against extremes. I wouldn't like to see an absolute lockdown, although I have locked myself down because I'm no longer young, and I'm afraid to say I'm definitely in that category, that group that is vulnerable to this disease, and I certainly don't want to be exposed to it. One, I don't like to suffer very much, and secondly, I kind of like to live. So, and I do worry about it. So I've locked myself down, but I like moderation. So I don't think that that you need to fall on one side or the other. I don't think we need to have this harsh lockdown. There has to be a happy medium whereby you can guarantee, you can allow people to earn a living. An example would be, I'm going to take the example of Kenya. Of course, I didn't particularly like the fact that the Kenyans, the way the Kenyan police were used to beat up poor Kenyans just because they didn't make their way home on time, past curfew. However, I think, Kenyans have managed to allow Kenyans to continue working, but not to go out at night, not to go to bars at night, at least to have social distancing with respect to nightlife. That's a happy compromise. But when you're living in a country where there is no compromise. You're not compromising, you're not making any compromises, or at least the compromises are very limited with respect to the disease, to a virus. And you think somehow you're going to get away with this by the grace of God. Well, it's a dangerous, dangerous game. And it's putting a lot of people potentially at risk.
Thank you, Fatma. Roland.
Yeah. So thank you, Ben. On to my question. And it is really true that in such a pandemic, like any other situation, you may have cases of people spreading fear. You've seen videos, whether they actually are real or not, of bodies, people dying on the streets, and people coming to collect those dead bodies. We cannot verify them. We cannot be sure, these are, true images or not. And one thing that we are saying is that, states need, and this is actually speaking to the authorities in Tanzania, the government of Tanzania needs to ensure, the effective exercise of the right to freedom of expression without discrimination in terms of, protecting individuals against abuses of these rights by non-state actors, yes, but also authorities require to prohibit and address the effects of spread of information that amounts to advocacy of hatred, around things that are spread to, incite, to create hostility, to create, fear, or outing persons, infected with COVID-19. And this should actually be with a good intent, not necessarily to, to criminalize such kind of acts whereby somebody is found to have shared information and, it is taken as criminal. We are seeing a lot of surveillance. The Tanzania Communications Regulation Authority is surveilling a lot of, communication. And this is from the authority of, the head of state, whereby, telephone conversations, WhatsApp images, people are getting, people are now afraid to even communicate between themselves. And what we're saying is that any measures that government gives to, protect individuals against, false news, against the spread of fear in such kind of news, must meet all general requirements of any permissible requirement or restriction to the right to freedom of expression. So I think one of the things that I would really want to emphasize is that it is not right to spread fear, but again, any person that is caught having sent messages should actually not, that should not really be criminalized. I would also just want to add, and this is with regards to what Honorable Zitto Kabwe said about, Media Services Act now being used a lot in terms of, getting media outlets, suspended or penalized for their reporting. We are likely to see this continue as a new norm, even after COVID-19. Since the law was promulgated back then in 2016, is it? We have seen cases whereby media outlets have been penalized for their reporting. But with COVID-19, we are seeing a situation whereby it is now farmed, and media reporting on COVID-19 has been made criminal. No one can report anything on COVID-19 right now in Tanzania unless it is positive news of what government is doing. That is wrong. Thank you.
Thank you very much, Roland. And finally, Zitto, do you have any response to my questions there, particularly on justifying those numbers?
Yes, and I saw you when in your first question to Fatma, you mentioned about the economy, and I did not see Fatma responding to it. Deloitte has made the estimations regarding the economic impact, and the the losses between January and March on the forex from tourism is around $340 million, and around 480, and this is the official government report, that 480,000 people have lost their jobs in tourism sector. So concentrated mostly in Northern Circuit and Zanzibar. Actually, Zanzibar, the situation is really, really bad. I'm working with one of the lawyers who have a lot of clients who are in the tourism sector. It's really, really bad, and it has affected not only the tourism sector, but the whole value chain on the tourism sector. Another one, I read yesterday, the Bank of Tanzania published the quarterly economic review, and it is online already, and it has indicated some challenges. They did not publish the growth rate for Q1, which is very interesting. They reported the last quarter of 2019, while they are supposed to report the Q1 between January and March. But the revenues from consumption taxes, VAT, value-added tax, has gone down. They did not reach the estimate by 50%. So it could be the estimates were put higher, or they because of the COVID-19 and people reducing consumption, maybe it has affected the tax revenues. And we are waiting for the report from Tanzania Revenue Authority, because the information that we get from inside showed that the last month, the month of April, they collected below 1 trillion, which will be very, very remarkable. But we are waiting to get the official report from the government. And yes, regarding the cases, as I said, these are very difficult to verify because of the lack of testing from the government. These are the estimates that I got from doctors, and it is their, I can call clever guesses. So we have to take it with a pinch of salt. It doesn't mean that we have to take the whole of it, but I am very sure that the cases are very, very high. I think we will be able to finalize our work on the deaths in Dar es Salaam, because that's the only area that we are concentrating for now. And maybe after the report coming out, and the pressure that we'll be putting on government, we might at last be able to accurately estimate the cases and the deaths. And I think the biggest problem that we are having is the lack of data, secrecy. And as I've been saying all the time, that the government is treating COVID-19 pandemic not as a public health issue, but as a national security issue. You have seen the changes that have taken place in the Ministry of Health, from the head of lab and her assistant, from the chief medical officer, permanent secretary, deputy Minister for Health. Only a minister has remained. Only a minister. Of all the key people in the Ministry of Health who were on the front line on the COVID-19, only the minister have remained. And some of us know that the new permanent secretary, Minister of Health, is a former or ongoing a personal physician of the president. And the new chief medical officer is a former or maybe ongoing, but we know that he was a doctor of the president's mother, who is sick in Chato. I hope she gets well soon. She has been sick for a very long time. But that's the reality. So the president has taken his own personal staff, one treating his mother and another one treating himself, to head the Ministry of Health. One is the chief medical officer, and another one is the permanent secretary, Ministry of Health. We don't know now who is doing the testing for the truck drivers. And as all of you know, that in the agreement between the government of Kenya and the government of Tanzania, the government of Tanzania asked the government of Kenya not to name the nationalities of the truck drivers which the Kenyan authorities have tested. So what are they trying to hide? These are the situations that we are confronted with in the country. So most of the things are definitely guess or clever guess, but we are still working on the ground to find out what's the really state of the COVID-19 in the country, while waiting for what they call a second wave in July or in July. But one doctor yesterday told me that in the weeks to watch is 2 to 3 weeks from this week, because of the congregations and the gatherings that took place during the Eid festivities that took place in Tanzania a few days ago. Thank you very much, Ben.
Thank you very much, Zitto. Before I open to the floor, I know we have a medical doctor with us. I notice also he's commented in the comments to me that he'd be willing to speak briefly. So I'll introduce him in a moment, and I notice he's put his initials, so I'm not going to introduce him by name unless he wants to do so himself.
Okay, do you want to go over to me now?
Yes, Karibu-san.
Yeah. Okay. Can you hear me? Yeah.
Yes. Thank you.
Okay. Just to introduce myself briefly. I'm not showing myself because I'm wanting to return to Tanzania, so I want to be cautious in what I say. And this is being recorded. I was working in Tanzania as a doctor and left at the end of March to get back here just before the lockdown. Since the lockdown here, I've actually been working for 111 and talking to a lot of patients with COVID. So I have a bit of experience. Actually, I think that what Tanzania has done is probably about right. This COVID is a very infectious disease. It is spreading rapidly, it spreads rapidly, and ultimately, everyone is going to get it, unless there's a vaccine. And if there's a vaccine, I think Tanzania is not going to be on the top of the list to get the vaccine. So we're talking about a year or possibly 2 before there's a vaccine available in Tanzania. So how are you to manage it in a poor country with not very good health facilities, with testing facilities that were non-existent before COVID appeared, had to be set up with help from the WHO? I think it's very difficult. I mean, you look at how we've managed it in UK, we've not managed it very well. Testing facilities have not been adequate, etc. So what is the point of locking down? What are you going to achieve by locking down? In Uganda and Rwanda, they've locked down and created a huge amount of hardship, poverty, and shortage of food. Some people in desperate situations. And what have they achieved? Well, they may have delayed the virus, but I think we'll see over the coming months that it'll come, it'll spread, because I don't think there's anything that anyone in any country can actually do ultimately to stop it, except perhaps New Zealand, which is very isolated. In this country, in UK, we've locked down in order to help the health service to be able to cope with the surge so that the hospital is not overwhelmed. Well, health facilities in Tanzania were never going to cope with a major surge and never going to be able to cope with a lot of people needing ventilating. And even then, you go to ventilators and 50% of the people who put on a ventilator don't survive anyhow. I think the death rates will be much lower than the highest ones that Fatma or someone quoted as being projected for Tanzania, because the population is much younger. Those who are at risk I mean, in this country, what is it? 1/4 of the deaths have diabetes, and most of the deaths are over 75. Now, the number of over 75s with diabetes and hypertension in Tanzania is really actually very small. It may be that elite group who have been hit first time round, but in the rural areas, it's very small indeed. I think that herd immunity is going to be the only way out for Tanzania. And in a sense, the decision seems to have been made to accept the hit and say, okay, it's going to be bad, but within a few months, we'll be over it. Whereas in UK, we're going to be living with this virus until there's a vaccine, and we're going to be living with restrictions and economic shutdown for a long time. In Tanzania, of course, also, the age distribution is much lower. The average age of the population is much, much lower than in UK. There aren't nursing homes. There's also actually a suggestion that one of the reasons for mortality amongst the immigrant population in this country is because of lack of vitamin D, because of lack of sunlight here. Of course, in Tanzania, sunlight is not something that is in short supply. So I think that actually overall Tanzania has not made a bad health fist of managing it. I think it's unfortunate perhaps they've not been prepared to be upfront. I think we will never know the full numbers. The testing is never going to catch up. And those that die often die of severe pneumonia. But before I left Tanzania in March, in the hospital I was in, we had 2 relatively young people admitted with severe pneumonia. Both of whom died. Now, I don't think that was anything to do with COVID, but that is part of what we see. So I think there'll be an increase of deaths from pneumonia, and there'll be increase of patients coming up with flu-like symptoms who will probably be given antibiotics, but we will never really know the full extent. And unfortunately, whatever you say, the system for recording deaths in Tanzania in the rural areas is not complete. Certainly, cause of death is not always recorded. So we will never really know. And even the numbers of deaths, we probably won't know.
Thank you, Doctor. It's very useful to get the medical's perspective on this topic. In a moment, I will open the discussion to the floor more generally. I can see in the list of participants, there is one hand has been raised already. I would invite others who wish to speak to raise their hands. If you're not sure how to do that, if you go to the list of participants, at least on a computer screen, you should be able to, there should be a button saying raise hand. If you wish to speak, I will in a moment go through the list and invite people to do so. Before I come to that, however, I note there've been some questions in the chat already. So I'd like to invite, as a first round of questions, if you like, I'd like to invite the panelists to respond to what the doctor has just said, together with 2 questions from the chat. First, from the chat, on the possibility or the scheduled general election that Tanzania has coming up in October, given that elections don't just take a few weeks in October, what do you think the prospects are for holding the election in October? And do you, as panelists, do you think the election should go ahead in October if indeed there is a significant outbreak in the months leading up to that? The second question from the chat comes from Tom, who I think is in Kenya. And he's asking, given the challenges experienced at the borders by neighbours in East African Community and Southern African Development Community, what would you envisage as a workable solution moving ahead for tested trading relations when there is not the same adherence on the Tanzanian side to those kind of measures as there is in other countries? So could I invite the panelists to respond to those three questions? Let's start again with Fatma Karume. Karibu-san.
Asante. You know, Doctor, the issue of herd immunity has plagued me, and I've been thinking about it a lot, to the point where it's quite depressed. It's depressed me. So I think it appears on the surface extremely attractive. I mean, when you look at demographics, it appears attractive because one says, well, you know, it's a young population, they can take it, they're not going to die. There aren't any, there are very few people who are past 75 who have diabetes and so on. But we have no idea, actually, because this is, again, this virus is novel. We have no idea what impact it will have on the rural community. We know that our rural community is extremely poor. Health services are extremely poor in the rural community. You know, we may not be looking at underlying conditions such as diabetes, but we're looking at other underlying conditions, malnutrition and so on. We don't know how this will impact the poor, but the rural communities. But there is something else that I think as a doctor you know as well. We have, I think, 1 doctor to every 20,000 people in Tanzania. And I don't want to repeat this, but there's a challenge there because it takes a long time to train a doctor. I'm going to give you a personal example. We have about 6,000, over 6,000 members of the bar. In a period of, it was 11 days in March, we lost 9 members. And these were my age mates and some older members. So you're looking at losing experts in their field. So herd immunity has a price. And the question for me is, are we prepared to lose these people who are in their prime? Because it's not, the fact of the matter is, it's not only people who are over 75 who die from this. There are lots of people, my age group, who have passed away from this, who have underlying conditions. And so, and for me, that's the dilemma. Do we just sacrifice these people? And are we going to just not even try and fight it? There is another thing about herd immunity, and I thought about this a lot. There was a diagram that I saw, a friend of mine sent to me, and basically the concept of herd immunity is the transmission of a virus is, if you can stop the virus with you from transmitting it to somebody else, the virus will die with you. Either you will die from the virus and be buried with it, or you will be able to fight the virus, and therefore you're one less cog in the transmission. And therefore, if you can stop this transmission, this sort of domino effect of transmission, then you actually do end up saving lives. So taking that into consideration, I would like to see the domino effect curtailed, because by not curtailing this domino effect, we are risking a lot more lives. Anyway, that's just my view, and that's what my concern is, and I may not have anything to be concerned about. I mean, God knows, you know, we might, given that there's plenty of vitamin D in Tanzania, and with our melanin, we're quite good at extracting it from the sun. we may not have to worry. We're young, and we may not have anything to worry about. The issue of, and then that goes to prayer again, the issue of elections as opposed to science, because we don't know. We don't have any scientific evidence or anything scientific to back up herd immunity as the way we should go. But going back to the issue of election, I think, given the fact that we've now decided that Tanzania's past its worst and we are on a downward trend, there is no reason why we shouldn't have an election. I mean, if you start off with a certain view, and that is that there is no COVID-19, or it's very limited and the infection rates are very limited in Tanzania, then we have to go along with that narrative. And that narrative can only lead to one conclusion, and that is that we're going to have elections this year. And a workable solution with respect to the borders, I always believe truth must be the beginning, has to be the foundations of negotiations. If one party is withholding information, if one party is not prepared to come to the table with its cards, showing its cards, then you can't have a workable solution. It becomes a game of cat and mouse.
Thank you very much, Fatma. Straight over to Roland. Karibu.
Asante sana. So I think the other issue, I wouldn't want to dwell so much into herd immunity, the technical, containment measures and all that, whether, Tanzania is doing it right or wrong. We may argue from here to wherever with that argument. What I want to really still dwell on is the issue of, where is the public trust? Where is, cooperation, regionally? There is a lot of strain already between Tanzania and its neighboring countries, with the East African Cooperation, members, with the SADC members, South Africa Development Cooperation, community members. There is a lot of, relationships that are already, punctured right now. And, in order to have that public trust, and this is what Tanzania really needs to do, in order to have that trust, affected community and society in Tanzania at large needs to have access to all relevant and available information. This is not happening. Tanzania should step up, its effort to really ensure that, they disseminate reliable, accessible, evidence-based, and trustworthy information. Tanzanians are left group. They do not know what is true. They don't know whether, wearing of masks is safe or not, because the direction from the president is that, do not, or the direction is that these things are already contaminated with coronavirus. Issues around, public disinfection or spraying of spaces, issues around, social distancing are already dismissed. And the reality is that, yes, nobody can stop coronavirus right now, but there have to be measures in terms of really protecting the vulnerable society, protecting those amongst the people that are most at risk. So why not really put up measures that can really, save that? When the authority tells people that, you can access the market, wash your hands as you go in, and wash your hands as you come out. Because that was actually one regional commissioner that mentioned that, the markets will still go on as usual for as long as there is, a water dispenser for washing your hands as you go into the market, and another, when you come out to wash it. That is not enough. you know. And the reality is that when you don't disseminate reliable, accessible, evidence-based and trustworthy information, you know, including the measures that you are taking to protect public health and address the pandemic, then you can't counter false or misleading information. Any public health measures, whether it's herd immunity, whether it's the containment like it's happening in Uganda, whether it's lockdown, you know, full lockdown, or in Kenya where it's partial, where you have curfews at night, or Rwanda where it's full lockdown, will not yield any fruits, because then the population does not understand what measure the state is really taking. And so I would say that Tanzania still has that obligation to ensure as well an enabling environment for freedom of expression, including by promoting free, independent, and diverse communication environment. That is the only key to ensure that all Tanzanians, or the majority of Tanzania, move in one, you know, in one sail, and they address disinformation and propaganda. That is key right now, very key right now. Thank you.
Thank you, Roland. Straight over to Zitto.
Yeah, thank you. On the election, I think it is very important, and the message should go out to the people who normally conduct the international election observation to prepare. Because my assumption is Magufuli is pushing for the election knowing that there will be no international observers. It happened in Burundi a week ago. And so we just have to see how this will be. I want an election, but also we have to be guided by the scientific evidence on whether it will be okay to do so. We are told, Kenyan government has said another peak will be in July, August. We're not different from Kenya, maybe because we have allowed people to be infected. And as Fatma said, I don't believe in herd immunity, and I'm very sure the government of President Magufuli is pursuing a herd immunity approach because of the way he's behaving. And even in his speech, he said so. He said that people have to get infected in order to have, not to be infected further. But herd immunity is Darwinism. It's a survival for the fittest. And we have to bear in mind, it's not just about age. It is also about, we have a significant section of our population who are HIV positive, and you have a lot of people with underlying conditions, and these are spread all over the country. With our poor health system, it could be more dangerous, and hundreds of thousands of people might lose their lives. I was in my last national address, I compared to the estimation of the number of people dead as the people who died during Rwanda genocide. The whole size of Njombe region. Ben, you worked in Njombe. You know, the estimation are showing almost the whole population of Njombe. If we go with an approach of herd immunity, we lose their lives. And I don't think if that's the right way. And I know that efforts can be done to prevent the spread, bearing in mind our health system, how poor it is. Thank you.
Thank you very much, Zitto. I've seen a couple of hands go up in the on the participants list. One has since gone down, so I will ask Baru if he wants to re-raise his hand to do so, but otherwise let me first introduce Anthony Elman. Karibu sana, Anthony.
Thank you very much, Ben. I'd like to bring up two questions. One relates to the pros and cons of lockdown, which has been talked about a lot. And I'm really presenting the experience of my older son, who is a doctor. He was born in Dar es Salaam in 1969. He now works with Médecins Sans Frontières, Doctors Without Borders, based in Cape Town, South Africa, but covering the whole continent right up to and beyond Tanzania. South Africa has had one of the tightest lockdowns in the continent, which has had very severe economic impact for small traders, sex workers, entrepreneurs, and so on. But it's also had severe health, negative health impact, collateral damage, because my son reckons that there are going to be more deaths from malaria, TB, HIV, AIDS, other diseases coming up than from COVID itself. Because people are locked down, they can't get to the health centers to get the treatment that they need. And a colleague of mine living in Kenya says also that there's been a big upsurge in malaria cases since COVID. And I wonder whether the same applies in Tanzania. The other question, if you don't mind my putting two, relates to a proposed treatment for COVID. There's a plant which you may know about, Artemisia annua, sweet wormwood, which has been grown in Tanzania. It comes from China, but the first country in Africa which grew it in the mid 1990s was Tanzania. And it's now used as the basis of the most effective treatment for malaria as a solvent extracting the active ingredient artemisinin. It's also been proposed, there's been a lot of push to use it as a herbal infusion for which there is no scientific evidence whatever of its effectiveness. And it's widely grown in Madagascar. And the president of Madagascar, this has been in the news, you may have heard of it, is proposing the use of a herbal tea. He calls it COVID organics. And he's been pushing it around Africa, including Tanzania, as a treatment for COVID-19, again, with no scientific evidence. And I think that this is really dangerous because it takes the eye off the ball, deflects attention from the search for a vaccine or for more effective treatments. And I wonder whether the panelists have any comment on that. Thank you.
Thank you, Anthony. As I don't see any other hands raised at this time, let's go straight back to the panel. If they've got some responses to, oh, sorry, before we do that, Baru, I see your hand has been raised again. So let's go to Baru first before we go back to the panel. Karibu-san.
Thank you, Ben. So I had lowered my hand because I didn't want to repeat what has been said already. And one of my questions, I posted it on chat, and that was to the anonymous doctor. And my question was, I think it is misleading when one is looking at the 75 years old and above when looking at the data from Africa. I remember reading this publication, a scientific publication, I don't remember the full title exactly, but it was showing like the age at which one becomes an elderly person. And they were showing for different countries at what age one would be considered now becoming an elderly person. And it showed that for most of the African countries, poor developing countries, actually that age is much lower. For some countries, it's like 47. So a 47-year-old in Tanzania being equivalent to a 60-something-year-old in Sweden. And my question there was, isn't it really misleading when one is looking at the 75 for Tanzania, instead of looking at the 40 plus or the early 50s, and what proportion of the population falls under that category, and then making those estimations of how many deaths we are going to experience. And then the other thing that I just felt like I really wanted to say something, but Roland and Fatma has responded to it. I felt like when the anonymous doctor said what the Tanzania government is doing is about pride, that I don't know, I felt provoked, but I also felt like that is a very dangerous statement to say, because that can now be taken as a blank check, a very general statement that now everything that they have been doing or not doing is validated by doctors. It's not just going to be anonymous doctor, it's validated by doctors. And for them, it will go beyond it just being a medical opinion, that in the absence of a vaccine, in the absence of whatever kind of treatment, but it will be taken as a blanket statement to validate each and everything that they have been doing and not doing, including, as Roland has very eloquently explained, the ridiculing of using masks. There has been statements of calling masks like rags, and people should not be putting on them. And we know that they help to a certain extent. So I just felt like that was a very dangerous thing to say, given that this is affecting people's lives. It's claiming people's lives. And we need to be careful with what we say and how it might be taken and used. I understand that this conversation might be remaining among those who are participating here, but I was shuddering hearing that. Let me stop there.
Thank you, Baru. I will give the doctor an opportunity to respond to that in a moment, but if first we could go to Fatma to respond either to the medical question again, but more particularly to Anthony's comments about the sweet wormwood medication and other things. Karibu sana, Fatma.
Sorry. Well, you know, Ben, I've been accused of being far too European about things. I just don't believe in any of this wormwood and all that. And I think it was just another way of taking the conversation away of giving Tanzanians hope and taking the conversation away from the disease. And unfortunately, it's false hope. And maybe in politics, sometimes these things work, but they don't work for somebody like me. I find it very, very sad that the majority of the people of Tanzania are being misled and they're being led down a rabbit's hole when it's not effective. Now, I just wanted to say one thing, Baru, with respect to the doctor's views. I rarely think views are dangerous. They're just views. And I just want to sort of say he has a right to his views, and we may not like them, but they're his views, and there are people, there is not people, there are countries that have followed the herd immunity, such as Sweden. They would argue not fully followed it, but who have these, and very, very well-informed epidemiologists have come up with this idea. I mean, I don't like it because I'm a humanist, and ultimately I just balk at the idea of this Darwinian concept of survival of the fittest. And I'd like to think of ourselves as, at least let's try and assist those who are not the fittest. And so, yeah, I don't think it's negative. It's just a different perspective. And it may not, sorry, it's not dangerous. It's just a different perspective.
Thank you, Fatma. I'm going to keep us moving because we're running short of time. Roland, do you have any response to add here?
Okay, yeah. Let me just respond with regards to this plant Achemasia. So not so much of a human rights issue. I believe it is the same, the same that has been used to create, to make that concoction in Madagascar, the Achemasia, which also we've had Tanzania president say that he's made orders from the Madagascan president. So I think unless everything is tested, and this is where we actually again getting it wrong, whereby we have a leadership in Tanzania that has disparaged scientists or disparaged science and dismissed science. So unless we actually get all these drugs, this herbal miracle cure passed through tests, then I do not think it is really the time to really meddle or take risks with people's lives. So I've heard about the Artemisia plant. I don't know whether it's found in Tanzania. Fatma Zitto may confirm this, but yes, there is a lot that need to be done.
Herd immunity, but if you just go crazy, you'll kill a lot more people.
Thank you, Roland. Zitto, karibu sana.
Sorry, very shortly. I think the president's approach is a gamble, and he thinks that he's protecting the economy, but at the end of the day, we will see, because then economic numbers will obviously be open. It may take time, but we will see if that gamble pays. And my only concern is that he is gambling on the lives of people, and I will not stand that. Thank you.
Thank you, Zitto. I see a hand up, Alan Edwards. Karibu sana, Alan.
Thank you. The point I would like to introduce into this is viral load. It may be that it's inevitable that herd immunity is the only solution for Tanzania, but it seems counterintuitive that we should be welcoming its rapid dissemination throughout the herd in the way that's being done, without taking some sort of attempt at social distancing and so on and so forth. And the reason that's important is that you can get a young person who has a mild dose, a mild exposure to coronavirus, and the lung gets infected and it can fight back, and you can end up with a fairly mild dosage, a mild situation. If you get multiple dosages and your lungs get bombarded simultaneously with lots of infection, there is a much, much greater chance you're going to die. I mean, the most obvious case to quote is the original Chinese doctor who discovered the problem and was doing his damnedest to cope with this, and was aged about 31, and he got such a heavy viral load that he died. And I think that the Magufuli approach is just ignoring that part of the equation.
Thank you, Alan. It's a very useful contribution. I'd like to, before we go for one final round of comments from our panel, I'd like to just check whether our doctor would like to respond to some of the comments in response to his remarks earlier.
I felt that the policy in Tanzania is not perfect, and I think the secretive element of it is not helpful. The last point made about viral load is interesting, but I haven't seen anyone do any work on that. It would be something that would be very interesting if someone could try and do some follow-up on that. Otherwise, yeah, we don't have data from African countries as to how vulnerable or the population actually is. I mean, I suspect, for example, that people with HIV who are poorly controlled will be very vulnerable, but we don't know whether it's chronological age or apparent age that is important.
Great, thank you, Doctor. And let's, before we finish, let's just go once more around each of the panelists if they have any closing remarks to add. Karibu sana, Fatma.
Asante sana. Hence, I think I'm going to steal Zitto's words, and I can only end with gamble. Hence, it becomes a gamble with the people's health because we just don't have sufficient information. We're not collecting the information. We are ignoring science, and that makes the gamble even bigger. And let's assume somehow Africa has the key to a better understanding of this virus, or holds the key because of our demographics, or because of the sun, or for whatever reason. Without information, without collecting data scientifically, we cannot be of any help to the human race. And that is of great concern to me. Thank you.
Thank you, Sana Fatma. Roland, karibu.
Yes, I think my closing remarks on as in at this point is basically to say that already there is a lot of weaknesses that have been exposed with regards to COVID-19. The COVID-19 epidemic really has exposed a lot of structural failings, fissures in states' health and social safety systems, which needs investment and time to repair. And Tanzania, just like any other country, especially in the region, needs to be very honest with its citizens and everyone else so that they build from this pandemic. We need a new normal whereby things are better, and things are better means that there has to be trust, there has to be public trust, there has to be relationships, there have to be regional cooperation. States have to trust each other. That cannot happen when Tanzania is withholding information, when there are mistrust issues, when there is a lot of secrecy in a pandemic that has affected many countries. Thank you very much.
Thank you, Roland. Karibu sana Zitto. Closing remarks.
Ben mimi tayari.
Okay.
I've already given my closing remarks.
Okay, great.
Yeah.
Thank you very much, Zitto. In that case, all that remains, I think, is to say shukrani sana to our three panelists today, Fatma Karume, Roland Ebole, and Zitto Kabwe. From my perspective, I found this a fascinating discussion. Judging from the comments, it's been engaging for plenty of other people. Thank you all very much for your time, being able to join us today, and look forward to being able to meet up with some of you in person when that's a bit easier to do so. Thank you very much. And I think that's it. Goodbye, everybody.
Goodbye. Thank you very much.
Ben.
Hello, Elizabeth. Yes, karibu sana.
I'll just say a very big thank you to you for chairing this meeting and to all our speakers for being very open with us. And thank you all for joining in. Thank you.
Thank you.
Thank you, Ben. Thank you.
Yes, thank you very much, Ben from TDT.
Thanks, Jonathan.
Thank you, Ben.
Thank you, Ben.
Cheers,
Thank you, all the panelists as well, of course.
It's a shame we can't all have coffee together afterwards.
It would be good.